Dr. Whitman, for people who are exhausted, foggy, and feel like they're failing, not because of lack of effort, but because their body just isn't cooperating, how could you think something as simple as mouth breathing or chewing habits can be the hidden key to turning their life around?
Yes, it's a great question, Doug. Thank you for having me, by the way. When we breathe through our mouth, many people don't realize, but you are actually getting less oxygenated. You get about 20% less oxygen through your mouth versus your nose. Your nose actually also humidifies and filters for you. And so that can certainly have an impact on how you're feeling, if you're taking in more bacteria, viruses. Um, and also, when we breathe through our nose, our paranasal sinuses release nitric oxide. And so that helps with cardiovascular health. Mouth breathing will impact the oral and the gut microbiome. It affects hormone release, especially in kids. So most hormones are released in deep stages of sleep. And so if we're not getting into those deep stages, as many mouth breathers do not, you're going to have issues with hormones. And so that can all make you feel crummy, and make you feel depleted and certainly not fully rested.
And so when it comes to mouth breathing, like how can people begin to stop doing that? Like we've heard about the dangers of it, on different podcasts and a lot of people have talked about it. Like what's the most effective way you think to stop that?
Yeah, it's tricky. So we really should separate it into children versus adults. So I'll start with adults first. Adults is a lot harder to unpack. So first and foremost, you need to know the why. Why are you mouth breathing? Is it structural from a hard tissue standpoint, meaning the skeletal system, the jaws, the bones? It can be a deviated septum. Okay, so the structure of your face, your jaws, or is it soft tissue? Is it a muscle imbalance? Is it redundant tissue? Are we a little overweight? Is it tonsils, adenoids? Do you have inflamed nasal turbinates? Do you have allergies? So it's quite a bit to unpack. And so working with ideally an airway trained dentist would be my recommendation. And we can put in the show notes how people can find such a dentist, but they will help triage it. And so, depending on your need, they may want you to have a sleep study as an adult because we do want to rule out sleep apnea. What many people don't realize is sleep issues are on a continuum. Sleep apnea is end stage, but you can have sleep disordered breathing, dysregulated breathing, before that. We don't want to get to the end stage if we can avoid it. So you may have a sleep study, and then you may need an oral appliance. They may recommend surgery, jaw surgery. There's now much less invasive ways to change the shape of your face, change the shape of your jaws. Sometimes there's retainer therapies where you can work with a functional orthodontist. You may need to see an allergist. You may need to work with a myofunctional therapist, and they are like physical therapists for breathing who work on tongue posture and tone of the muscles and reteaching us how to keep our lips closed, breathe through our nose. They can reboot the nervous system essentially, because a lot of times when we mouth breathe, we do tend to be more fight or flight. We're more sympathetically driven. And so it's a bit to unpack, and so you need to work with experts and just knowing it's a commitment, but it's well worth it because if you're breathing well and sleeping well, everything else will be better in your life. I don't think anything is more foundational than that. And with kids, it's similar, but we can intervene much more easily. So we can notice as young as infancy, just the first few months of life, if we think a child is going to have chronic airway issues. And again, it has to do with the shape of their face, the shape of their jaws. Do they have a tongue tie that's been missed? And this includes adults too. You could have a missed tongue tie or restriction. But we can intervene so much easier with children because they're so adaptable and easy to mold. And, so we can start with early retainer therapy. There are different appliances. I mean, you can start in infancy and then certainly up through toddler years and really course correct these issues pretty quickly. So if you're a parent out there, I do recommend that you observe your child. Do they have open mouth posture? Are they mouth breathing? Do they snore? Do they grind? Do they toss and turn? Are you noticing behavioral issues? A lot of kids get pegged with ADHD, and it's actually an airway issue, chronic mouth breathing. And this can translate into adulthood too. So I think we can't underestimate the power of oxygenation to the brain in these early years and the importance of regulated hormones and the importance of nasal breathing.
We got right into it, right? And then we talked about, why mouth breathing is a problem. We've talked about in depth, maybe some of the solutions that can take place in order for people to fix it. But for people who are like, you know what, like this sounds too in depth, this probably isn't as big of a deal as I think it is. Talk a bit about like in depth, like why like mouth breathing can be so dangerous. I think of it I think of it from an efficiency standpoint that if you are using so much air to breathe and being ineffective with your breathing, it's obviously going to tire you out. You're going to feel uh, lazy. You're going to feel like you have fatigue, all these things. But I would love to hear your perspective.
Yeah, absolutely. Well, it can come down to lifespan too. People who overbreathe, there are studies to show have a shorter lifespan. And James Nestor speaks about this in his book Breath. Some of the monks that he traveled with and the Buddhists that really practice breath work and rhythmic breathing. The less you breathe, the longer you live is a gross generalization, but it seems to prove true. Um, Oxygen's the most powerful and important thing for our bodies. So it's necessary to supply efficiency in the body, as you mentioned. It can affect cardiovascular health. It can lead to erectile dysfunction. That's the one that gets a lot of people's attention. Again, because of the nitric oxide component. If you're mouth breathing, you tend to have lower nitric oxide levels. You're more likely to have high blood pressure, cardiovascular disease. So it's not something to be it's something to be taken quite seriously. People who get their breathing under control, and especially if they wear any sort of sleep metric or trackable, they'll see a huge difference in their sleep quality, their sleep scores. Often we see heart rate variability go up, VO2 max. If you're training and your nasal breathe, this is why we see a lot of athletes now. They'll lip tape during performance and training. It improves performance and recovery and optimization and VO2 max that way too. So it's not to be taken lightly. And, maybe people have heard of mouth taping or lip taping. So that is a little tip or trick people can play around with. I don't like people just jumping to that without ruling out sleep apnea. I personally mouth tape or lip tape every night. That's just the act of literally keeping your mouth closed. I don't recommend people do that if there's a true obstruction. So you want to make sure that you can comfortably and successfully breathe through your nose for 3 to 4 minutes. But as you're unpacking the why and you want to start feeling good and optimizing your health, that is a nice trick, is to start lip taping or sleep taping.
Yeah, and you mentioned that breathing more has this negative impact on your life overall, right? And yet the opposite, I think, is true of chewing. I've heard you talk about like one of the habits that really can impact people's health in a negative way is what we eat and how that impacts oral health, etc. Talk about why processed foods are so problematic for people as it relates to what we've been talking about.
Yeah, absolutely. So, ancestrally, we had a lot fewer health problems than we're seeing today with this airway stuff, okay? And cavities as well. So, I should mention mouth breathing is one of the top reasons people get cavities, including children. So, if you find you keep getting cavities, but you're doing everything correctly, in your opinion, you're flossing, you're brushing, you're eating pretty healthy, I want you to think about, are you mouth breathing? And it's because it dries out the mouth, it changes the microbiome, and it can shift things to become more acidic. So ancestrally, we estimate we used to chew about 4 hours a day. And if you think about the act of chewing, you're displacing a lot of force out. It's called lateralization. Your tongue has to move. And so in infancy, this begins with breastfeeding. Okay. And I realize not everyone can breastfeed successfully, or maybe it doesn't resonate, but breastfeeding is the best way to grow a face and shape the human skull and the airway initially. And then we're supposed to transition into chewing. And so when we were a hunter-gatherer society, we were foraging, there was a lot of chewing. Again, about 4 hours a day is what they estimate. Well, now flash forward, the agricultural revolution happened. We started farming, and then the industrial revolution happened. We started milling and processing and mass producing. And now it's estimated we chew about 4 minutes a day. And that's the Go-Gurts and the, Frappuccinos and the chicken nuggets and the mac and cheese. Like, we just don't chew enough. So we're not having these forces to expand the face and the jaws and to grow optimally. And that is why we're seeing such an epidemic with small faces, small jaws, smaller sinuses, smaller palates, crowded teeth, and airway issues. And so this is epigenetic. It's been going on for many generations, so we do love parents to breastfeed and introduce whole foods. There's something called baby-led weaning, something you need to do safely and work with a provider, but that can help combat some of these issues. But inevitably, we're going up against generations of disevolution is how it's been coined by others besides myself. And so we're shrinking. It's why we don't have room for our wisdom teeth. If you go into the Natural History Museum and you look at a skull from 10, 12, 15,000 years ago, you will notice their teeth are perfectly straight. There's no decay. And their wisdom teeth are in, okay, successfully. And now you hear so many people, quote unquote, need their wisdom teeth out. Well, it's because our jaws aren't big enough. And now many people don't have room for their premolars. So the idea is that we're just getting smaller and smaller, and this is affecting airway volume. And the issue is our tongues are staying the same. So our tongue is this big muscle. It hasn't decreased in size. And so where does it go? If the house is too small, the tongue can't fit, where does it go? It goes back into the throat and it blocks your airway, especially while you're sleeping, or it hangs out of the mouth like Napoleon Dynamite. And so with kids, we want to recreate how we should have been ancestrally. And that's why we want to do these expanders and retainers and functional orthodontics to grow the face again. And they're coming up with really, really cool ways to do that in adults too, that not always, but can sometimes avoid more invasive surgery.
We've talked a lot on the show about the types of foods to avoid and to eat for things like longevity, fat loss, muscle building, etc. I'm curious, like, do the same rules tend to apply for maximizing oral health?
Absolutely. Yes. Luckily, the body is it's all connected, but to simplify, I mean, whole foods are important. Um, I prefer foods from farms, not factories, just to simplify it. Things from the earth, not from mills. So, we live in a modern society. Parents are on the go, humans are busy, but the more we can get back to the basics, the better it is for our oral microbiomes, our gut microbiomes, and our whole body. So nutritionally, to develop strong teeth and jaws, it's the same of what we need for bone. So we like to focus on fat soluble vitamins, so particularly vitamin D3, K2, vitamin A, vitamin E. Many of us are vitamin D and K deficient. We're just not getting enough of that. We're not outside enough. Some of us have genetic polymorphism, so we're just not utilizing vitamin D or assimilating it appropriately. We have leaky gut now, so we're not absorbing our nutrients appropriately either. So we do want to up our minerals, but particularly magnesium and calcium, obviously, for dental development. So many of us are magnesium deficient too, because our soil is depleted. And so I'm starting to see what I believe is an epidemic in undermineralized teeth in children. So the teeth erupt undermineralized. It's something called hypoplastic enamel. And I believe this is a epigenetic nutritional malnourishment, essentially, because we're so deprived of appropriate vitamins and minerals. And so it's concerning. But as someone who is maybe a couple looking to conceive, or you're pregnant, I mean, really optimizing yourself because baby teeth form in utero, and then optimizing your child after through breastfeeding, food introduction, and then as adults too. Many people have heard of Weston Price. He was a dentist in the 30s who he wrote a book that talked about this, that how fat soluble vitamins and minerals were so critical for dental health. And he traveled the world and looked at more ancestral tribes and studied their diet and studied their teeth. And a lot of his research was it's criticized for not being up to standard nowadays, but he brought up some important points that it's really the diet that influences oral health so much and facial development. And so doing as much as we can to stay optimized. And of course, that's going to help your gut health, and that will help your systemic health too.
Yeah, we don't have to dive too much deeper into like exactly like what to eat. I think the audience at this point has a general idea, and like I've said, we've covered it extensively on the show about the top foods to eat, top foods to avoid for overall health. What I am curious about is I remember growing up, people would say chew your food like X amount of times before you swallow it. What does the science say about like chewing your food to make sure that you're getting like the proper jaw development, proper digestion, etc.?
Yeah. Well, I mean, we do tend to inhale our food or mash our food. And so we have to remember digestion starts in the mouth. I want everyone to think of the mouth is the gut. If you have that mindset shift, I think you approach things very differently. And so we do want to focus on prebiotic fiber and probiotic foods, fermented foods as well. But it's extremely important. I can't give you an exact number, like how many times to chew, but we do not chew enough. It's something I certainly have to work on. And it will help aid in digestion too. So if you have gut issues, digestive issues, issues with bowel movement, or issues with nutritional absorption, if you find that you're chronically depleted, but you feel like you're eating well, it could be a mastication or chewing issue. You're just not allowing the digestive enzymes in your mouth to do its work. And so slowing down, mindful eating, it will not only help with those external forces in childhood, ideally grow the face more optimally, but it's going to help with your gut health too.
All right, let's get into the hot topic of the day, which is talking about like things like toothpaste, fluoride, mouthwash, which they've been highly controversial over the last several years. Um, what's your overall take on like the oral health products that exist? Which ones do you personally believe are great that you would recommend to your patients for their mouth, and which ones do you think people should avoid?
Yeah, great question. So let's start with mouthwash. Unfortunately, the messaging in dentistry for so long has been it needs to kill 99.9% of germs, and that's what we need. We need that burn, that foam. We've learned that is incorrect thinking. Just like we're over sterilizing and over disinfecting our homes and our hands, all this hand sanitizer and bleach, and we're over cleaning. So what does that do? That affects the microbiome. So mouthwash in particular, your Listerines, your chlorhexidines, which is a prescription your dentist may give you, they're just carpet bombing your mouth. So the astringents, the alcohols, we now are learning a lot about the oral microbiome. So we have the gut microbiome, we have the oral microbiome. There are many healthy bacteria in our mouths that are needed for various reasons to help digest food, to help with the remineralization of our teeth, to help with nutrient absorption, immune function, etc. So if you're putting in this non-selective astringent or alcohol, it's just carpet bombing your mouth. And this is why you may have perpetual issues. The mouthwash is just masking your problem. It's like spraying perfume on yourself when you have body odor almost. You're not getting to the main issue. So if you find you have chronic halitosis or bad breath, that is not normal, and mouthwash is not solving for it. You're actually probably making it worse. So we need to understand why. Do you have an infection in your mouth? Do you have periodontal disease or gum disease? Do you have tonsil stones, postnasal sinus stuff? Like, why is your breath bothersome? Okay. But the other issue with these strong mouthwashes, there are studies to show it can impact our cardiovascular health, particularly it can increase blood pressure. And why is that? Well, on the dorsum or the surface of our tongue, it's where we produce bacteria that help facilitate nitric oxide production. Nitric oxide production is important for cardiovascular health and sexual health too. So if you find you're struggling in any of these areas and you're a Listerine addict, I would suggest you throw out your Listerine. Well, I suggest everyone throw it out effective immediately. People will always say, well, what can I rinse my mouth with? I'm a fan of just water and baking soda, maybe a little high quality salt in there because it's antiseptic, but we really don't need to be rinsing our mouth. I think it's overkill. So for other products, I mean, I want people to start looking at their toothpaste like you do the ingredients on your food. And we're learning more and more there's some pretty nasty ingredients in some of these products, even ones that are marketed as clean. You know, there's propylene glycol and titanium dioxide, sodium lauryl sulfate. That's what makes things foam. And all of these ingredients have an impact and effect on the microbiome, many in a negative way. They can also irritate the oral mucosa. So if you tend to get ulcerations or canker sores in your mouth a lot, that can often be from sodium lauryl sulfate or its derivatives. Um, Propylene glycol can be linked to DNA damage and other kind of, scary things. So less is more. Even essential oils, which sound great, they're antibacterial and they're not selective. So they can actually be harming your healthy bacteria too. So just be mindful and try to look for more natural ingredients. We just don't need that burn and that foam. And that can be a mindset shift. And some people struggle with it, but many of the better toothpaste now, they don't foam and they don't burn. That strong mint, that it doesn't happen. And if people just can stick with it, you'll find your oral microbiome will reestablish. It can take some time, but you'll ultimately be healthier. And so I like to compare it to if you've ever switched off from a traditional deodorant, maybe an aluminum based deodorant, you switch to more natural deodorant. There was a transition time maybe where you found you were a bit odorous. And if you just stick with it, your body acclimates, your skin microbiome acclimates. It's the same with your mouth. Like we need time for our mouth to reestablish and our microbiome to reestablish. So people will always ask about a remineralizing agent or an active ingredient. In theory, it's true. Our ancestors didn't brush, they didn't floss, but they were not eating the diet that we are now. And also our gut and oral microbiomes have shifted. Like if you compare the microbiome to a hunter-gatherer, it's very different than the microbiome today. And we know this from testing the tartar on skulls that we have found. So the microbiomes have shifted. So I do recommend everyone floss and brush. Especially if you're eating any type of fermentable carbohydrate. And so that's crackers and chips and pretzels and granola bars and pastas and breads and just things of a more modern diet. So I do believe most of us need some form of remineralization in our toothpaste or an active ingredient. And this is where the conversation between fluoride or non-fluoride toothpaste come in. I personally am a fan of hydroxyapatite toothpaste. So our teeth are made of hydroxyapatite, which is calcium and phosphorus. Our bone is made up of hydroxyapatite as well. Our bodies have no fluoride in it naturally. So I tend to practice more biomimetically. I want to replace what's missing with what's natural. So hydroxyapatite's been around since the 1970s. It's been pretty much exclusive active ingredient in Japan, South Korea, Italy since the 1980s, and it's spreading. And it's now in the United States. It's just becoming more and more popularized. But I personally haven't seen anything work as well in my patients, and something that really cherishes and preserves the microbiome more. The issue with fluoride, number one, we shouldn't be swallowing it. It is considered a neurotoxin. Certainly children should not be swallowing it, but it is also antimicrobial. It's not selective. And so it can be damaging healthy bacteria again. And so this is why I don't like fluoride. Well, there's many reasons, but that's one, because of the microbiome. I want to preserve my microbiome. I want to nourish and boost my microbiome. But just like not all foods work with all people, not all supplements work with all people, not all protocols work with all people, not all active ingredients work with some people, and some may find fluoride works better for them. Some may find hydroxyapatite works better. The studies show hydroxyapatite, nano hydroxyapatite performs just as well at remineralization and cavity prevention as fluoride. And I think we're going to find in the next few years, it's going to become even more and more popular and get backing from some of the major dental organizations too. It's really already in the works. So there's more options out there than just fluoride.
I want to follow up on fluoride in a second, but first, as you were talking about switching to more natural products, um, one of the big pushbacks, and this is from myself included, is like the natural. To me, whenever I've tried like natural deodorant, natural toothpaste, whenever I've tried natural deodorant or even some like natural toothpaste, like they don't work as well, right? There's not that minty feeling that I feel like my breath smells fresh. I find myself having like body odor, later in the day that I didn't have when I used traditional deodorant. Um, so what's going on there? And are you convinced there's products out there that are just as effective as far as getting the job done as traditional ones?
Yeah, it's basically what I just mentioned. So your microbiome's reestablishing, and that takes time. So perfect is the enemy of good. I don't know what to say. You have to decide. If you need that minty burn feeling, you do you, but that is not helping your microbiome. So again, it's a mindset shift of what does a healthy mouth feel like to me. It's not squeaky clean and it's not burning. Squeaky clean means you've destroyed all of your biofilm, including your healthy bacteria. And I think um, if your body's in balance and you're healthy, you shouldn't have bad breath. And that's what I was trying to say earlier too, is if you find to the listeners, if you're like, gosh, I have to use something minty or my breath smells really bad, you have something else going on. There's some other imbalance going on. You might have gum disease, you might have periodontal disease. Maybe you need to start tongue scraping, like just cleaning your tongue with a stainless steel or copper tongue scraper can be very successful. Maybe you have something going on in your tonsils. Maybe you have reflux or some gut issue or postnasal drip or sinus issue. But generally speaking, your breath shouldn't be clearing out a room. And if it is, something is not right. So it just can take time. I mean, it honestly took me a couple years to transition off a traditional deodorant. And I would have to, as to your point, in the middle of the afternoon, I'd have to go reapply my natural deodorant or do like some essential oils or something, right? Because uh yeah, you do smell yourself, but it does go away eventually. It really does. It just takes time and we're all different. So yeah, I suggest people who are serious about preserving and optimizing their microbiome to try to stick with it.
Right. And I guess what I'm hearing from you is that so much can be solved if you just clean up your lifestyle. If you change the way you eat, if you change the way you sleep, you change the way you breathe, like a lot of this other stuff.
And floss.
And floss, yeah.
People don't floss enough. If I had to pick, I think flossing is so much more important than brushing. I think people think you only floss if you feel food stuck in between your teeth. It's not true. And so if you suffer from a lot of bad breath or gingivitis or just cavities, I mean, I'm wondering, do you floss nightly? I want people to start prioritizing it as a non-negotiable. I always like to give, these are my top non-negotiables. Flossing nightly is one of them. I would pick it above brushing any day of the week.
What else is up there for non-negotiables with flossing?
Nasal breathing. So that's why I mouth tape every night. If I do not mouth tape, let's say I'm traveling and I forget it, I will literally go find band-aids somewhere to try to like rig it because I will feel like garbage. Hydration to me is extremely important with some electrolytes, moving my body every day, getting outside. Um, What else is a non-negotiable? I mean, for me, I know I run vitamin D and magnesium deficient, so I do supplement with those as well, every single day. And then really trying to focus on what's on my fork. I do try to prioritize I try to eat a rainbow and feed my good guys and, support local farmers and just get back to the basics with how I'm eating. I really minimize processed food.
This episode is brought to you by Live On Labs. If you are someone who is constantly stressed, Feeling depleted and exhausted? I have some exciting news. My friends at Live On Labs have an incredible deal I can offer you. When you buy any product at full price, you get a free carton of their highly popular B complex product, which I take every day. Taking a B complex supplement can also help support things like a healthy metabolism, increased energy, blood sugar balance, and learning. Vitamin B supplements can help replenish nutrients depleted from stress. Live On Labs puts years of research into each product, which is why I stand behind them. Using liposome encapsulation technology, these products promote elite absorption so the supplements get into your cells and give you the best benefits that you're looking for. Right now, you can get a free carton of Lipospheric B Complex Plus, which is a $56 value with any full price purchase from liveonlabs.com. This supplement has the B vitamins and minerals that you need to help turn food into sustained natural energy throughout the day. Just add B Complex Plus and any other full price supplement to your cart and enter code BOPES24 at checkout to get this amazing deal. Now back to the show. So from flossing to the big F word, fluoride. It's become so controversial over the years. I really don't know much about it other than the brief research that I've done, preparing for this episode, and then also just what I've read on the news. And obviously it depends on what you're watching, who says what, and who you follow on social media. I will say, like, whenever I've talked about to my dentists who, through the years, my dentists traditionally have cared about like their health, about fluoride in the water and fluoride in toothpaste, they've always had positive things to say, like it prevents decay, reduces cavities, all these things. So what, like, based on like what you know about the science, like what is the beef with fluoride?
Yes, there's a lot to unpack here. I think it's important to know. So, water fluoridation began as an experiment in 1945 in Grand Rapids, Michigan. And it started without any safety or efficacy data. It truly was an experiment. And it was before evidence based medicine. And it was based on an observation from a dentist in Colorado Springs in the early 1900s who observed that his patients seemed to have stronger teeth, although they were really mottled, and discolored, but they didn't have much decay. And they finally figured out, well, that was from fluoride, high levels of fluoride in the water of the community. And he was observing dental fluorosis, which is a sign of fluoride in excess that you see in the teeth. And 40 to 60% of teenagers now have dental fluorosis. But the beef, so what I mean to say is, so even starting in 1945, it has been controversial. There have been people criticizing this since the beginning. I want to point that out. Lately, it's become extremely controversial because people are politicizing it, which is so unfortunate. But many of us, and certainly people before me, have been criticizing the practice of water fluoridation for a long time. And I personally have been criticizing it for 13 years. Okay. So it's important when we're talking about fluoride to separate topical fluoride from systemic fluoride. This means toothpaste, rinses, things that touch your teeth, to ingesting it, water fluoridation or prescriptions. So we used to think that ingesting fluoride, the fluoride would get, it would get embedded, it would work its way into our developing teeth and make the teeth more resistant to decay. This has been disproven. This was disproven 25 years ago now. I mean, even when I was in dental school, they were teaching it, which was a while ago. I was in dental school 20 years ago. They taught us that fluoride works topically, not systemically. So it's the act of the fluoride touching the teeth. You do not need to ingest it. Okay. And this is in the literature. The American Dental Association has posted research articles about this. So this is not up for debate. So you would think, well, why are we still fluoridating our water? And that's a great question. The NTP reports, the National Toxicology Programs report, it was under the Department of Health and Human Services. And it was a report that people have been waiting for. It took about 7 years to finalize. It came out last fall, 2024. During that time, there has been a federal trial, the TASCA trial, which is the Toxic Substances Act. Okay. And it was a federal trial that took 7 years. Also, the judge was essentially waiting for these expert testimonies and this national toxicology report, which finally he got it last fall. And then he made his verdict. His verdict was that there is an unreasonable risk to current water fluoridation practices in the United States. And the studies are showing that it is too much fluoride in the water is linked to IQ drops on par with lead in children. Okay, so if women are pregnant and young infants and babies are exposed to too much, it can affect brain development, neurocognitive issues. Also, separately, we know it can affect thyroid health, osteoarthritis, bone fractures in menopausal women, especially. So it's not without risk. People will say, well, the studies that are out there about this, they're at a level much higher than we fluoridate our water in the United States. And here is where I will argue against that. So the National Toxicology Programs report looked at 18 high quality peer reviewed studies. Several of them showed issues with neurocognition and IQ at our optimal level. And in the United States, we fluoridate at 0.7 milligrams per liter. Okay. So a handful of studies showed issues at that level. The rest of the studies were mostly at 1.5 milligrams per liter. So people will say, well, that's double the amount. But this is per liter. I need everyone to realize that. So how do we dose? People keep saying dose makes the poison. It's true, but how are we calculating dose with water fluoridation? You might drink a liter of water a day. I might drink 3 liters of water a day. Plus, I'm cooking with it. I'm making soup with it. I make my bone broth with it. I boil my pasta with it. Ultra processed foods have fluoride in them. Your Gatorade factory and your canned soup factory, they're not using reverse osmosis to filter the water. So if they're in a community that's fluoridated, there's fluoride in that processed food. It's in pharmaceuticals. Many pharmaceuticals have fluoride in them, prescription drugs, SSRIs, Prilosec, because it makes it more bioavailable. Plus, we're getting it in our oral healthcare products. Kids are swallowing it. There is no way to calculate how much someone's exposed to. So it doesn't take much to get into that range of neurotoxicity concerns. So that's a concern. Like, I think we get too stuck in the weeds. Like, we're so hyper focused on teeth, but we're not looking at what is this drug doing to the rest of the body. It's not even working to help teeth. Water fluoridation essentially has been disproven in the science. You're going to hear the American Dental Association, they keep pumping out this stat. It reduces cavities by 25%. That is incorrect. They are cherry picking that data. That is from an old report in 2007, the Cochrane Collaborative. The Cochrane Collaborative came out with a new study just last year, 2024. And it said, based on re-examining the data, water fluoridation reduces cavities by 3% on the population scale, or one quarter a cavity per person. It's not statistically significant. So we're risking IQ drops in kids on par with lead, neurocognitive issues, bone fractures in menopausal women. It's antimicrobial, as I mentioned. So what is it doing to our gut health? What is it doing to our thyroid health? It doesn't even work. All we need to be doing is using it topically. And people will also argue, well, how do the poorer families access fluoride toothpaste? They can't even access a dentist. I disagree with that. If you can get toilet paper, you can get toothpaste with fluoride in it. They have it at the dollar store. There are free clinics giving it out. Dentists give it out for free. This is an educational issue, and it is a public health issue, I agree, but the issue is cavities are not from lack of fluoride. The human body doesn't need fluoride. We are not fluoride deficient. There's no ailment in the body from fluoride deficiency. It makes your teeth less susceptible to cavities, but it doesn't cure cavities. If water fluoridation worked, cavities wouldn't still be a top chronic disease in our country, and it is. 70% of our US population has access to fluoridated water, and cavities are still our top disease. So it's failing. And on top, and even if you don't believe in any of what I just said, it's a medical ethical issue. So we're mass medicating a population without their consent. The other thing to note is the EPA itself has said that you need a 10x safety window, margin of safety for fluoride, 10x. So for people that are saying, well, at 1.5 milligrams per liter, that can cause issues. We believe that. We just don't believe it at how we're fluoridating now. So if you take 1.5 milligrams per liter and give a 10x window of safety, that's 0.15 milligrams per liter that we should be fluoridating at, and we fluoridate at 0.7 milligrams per liter. Why is there a 10x window? It's to protect vulnerable populations. Those are our pregnant women, our infants, people with calcium deficiencies, iodine deficiencies, kidney disease, genetic polymorphisms. So the EPA is ignoring its own criteria. And they said this under oath in this TSCA trial. So that is why the judge said there's an unreasonable risk to current water fluoridation practices. EPA, I'm putting this on you. You haven't been regulating this. You need to start regulating this better. And so the EPA actually has until next month, we're in the month of April recording this, they have until May now to appeal, but they have also said they're going to review the data over this next month before they decide how they're going to proceed. I'm confident there's nothing to question in the data that this should not be happening. Many people do not realize the United States is one of the last countries to fluoridate our water. 97% of the world, 95% of the world doesn't fluoridate anymore. Many of those countries stopped water fluoridation and their decay rates went down because they implemented educational programs and topical fluoride access. And that is something we should be looking at in this country too. But the burden of proof should be on the safety of anything that we're doing. We should never be mass medicating a population for a preventable disease. We're treating everyone the same. You know, I'm a very low cavity risk. I haven't had a cavity in over 30 years. I also haven't used fluoride in a couple decades. My kids have never used fluoride. None of us have cavities. Why am I being treated the same as people who are high risk? You know, when those people can use topical fluoride and have a better effect than drinking it. So it's really controversial. A lot of the pushback, it's the same things that I hear the same things. Dose makes the poison. It's perfectly safe and effective at the levels we currently fluoridate. If we remove the fluoride from our water, cavities will skyrocket. What about the poor communities? These are all valid points. Dose makes the poison. I just talked about that. We can't control for dose. The other thing is, I've looked at the data from communities around me. I'm in Portland, Oregon. We don't fluoridate our water here, by the way. And some communities test as high as 2.1 milligrams per liter. It's not well regulated. Everyone thinks it is. It's not. There are some facilities that I think have very high-tech equipment and it's very to the T. And there are some more rural communities, maybe they don't have access to this equipment and it's not titrated appropriately. So don't think it's exactly 0.7 milligrams per liter just because they say it's supposed to be. I mean, you should call your water bureau. So anyway, it's become politicized. Dose makes the poison. We just talked about that. It doesn't reduce decay by 25%. That is incorrect. I would argue that people saying that are lying. The American Dental Association knows that they're using the wrong data there. It's really upsetting. It's 3%. It's not statistically significant. Topical fluoride is what works, not systemic. And it has nothing to do with politics. That's what I would like to leave everyone with. And it's just because there are figures now in the political sphere who are also questioning the practice And these figures, RFK Jr. is controversial among some people, that now people are putting their foot down and saying, this is outrageous, this is anti-science. People have been talking about this for decades, that this needs to end. And it has ended in many other countries: Japan, Denmark, Sweden, Switzerland, Germany, Israel. I mean, we need to look globally, and we need to look beyond teeth, and we need to think about medical ethics. And just, if you want to use fluoride, just use it topically. That would be my advice.
And I think the big takeaway here is just to clean up your lifestyle again. And I think doing that will help prevent a lot of this stuff that we've been talking about.
You're absolutely right. No one gets cavities from lack of fluoride. It's a band-aid. People want to blame something. If you are healthy and balanced, if you're eating optimally, if you're breathing optimally, you won't get decay. I mean, those are facts. That is why our ancestors did not have decay. It's our diet and lifestyle. That is why we have decay. Fluoride gives us a little buffer. It gives us a little more protection for us maybe not having the most ideal diet and lifestyle, but it's not a cure-all. And this is why cavities are still the number one disease globally, is because we're not cleaning up our diet and lifestyle.
Um, so I know you talked about like the importance of flossing and how that would be something that is a staple in a nightly routine along with nostril breathing. I'd like to go a little bit more in depth. If you had to design a 5-minute daily oral health ritual that helps to support the brain, body, and sleep, what would be in it?
Yeah. So if I had to pick, I always prefer nighttime routine. I do like twice a day, but let's just go to the nights to not overwhelm people. Because if you load too much on somebody, this is like health coaching 101, they'll retreat. So at the very minimum, I would say I want you flossing your teeth at night and brushing your teeth at night. That's it. Now let's add to that, because we'll go to an optimal routine. Like, what do I do? So ideally, I also floss and brush in the morning. I would say you don't have to floss in the morning. Definitely, I would brush. I tongue scrape as well. So I wake up in the morning, I tongue scrape, I floss, I brush. At night, I tongue scrape, I floss. Sometimes I will then water pick too, just for some extra love. It works as well as flossing, but it does do things a little differently, especially as we age. We start to lose bone around our teeth, and so the water pick can get into the nooks and crannies a bit better. And then I brush. So just to repeat, at night I tongue scrape, water pick, floss, brush, and then I sometimes will take an oral probiotic too. Just like we have gut probiotics, there are targeted probiotics for the microbiome of the mouth. So I'll do that. And then I lip tape, after I've hydrated. So I do like to oil pull. We didn't get into this, but oil pulling is an ancient Ayurvedic practice. It used to be done with sesame oil. You can do it with raw or organic coconut oil is what I like. I do it a couple times a week. I don't like people to do it every day because lauric acid in coconut oil is antimicrobial. And so we don't want to bombard our mouth with too many antimicrobials. It's really gentle, but it will have some antimicrobial effect. So it makes your teeth just feel really great. It changes and modulates the biofilm, makes your teeth feel really smooth. It just feels good. But again, this is extra credit. I think the biggest thing is just floss and brush at night. And then if you have bad breath, consider tongue scraping too. And even more importantly, do see your dentist. I think so many people blow off the dentist, and I get why, but it's really important. You don't want periodontal disease, periodontal pathogens. Those are the bacteria associated with the bone loss around your teeth. Those are the ones associated with Alzheimer's and cardiovascular disease and rheumatoid arthritis and fertility issues and sexual dysfunction issues. So go in for your cleanings and checkups. Plus, they're screening for oral cancer. So it is really important to see your dental team.
Yeah. And so like I guess imagining somebody does this for a month straight, like what do you expect to happen to them?
The routine, Well, you should notice your gums get healthier. If you brush and floss right now and you notice your gums bleed or they hurt, we call it pink in the sink. That's a sign of inflammation. That's a sign of disease. So your gums should not bleed. They should not hurt. They should be really resilient and strong. So if you're following this routine, you should notice your gum health improves. Many people notice, especially if you're using nanohydroxyapatite, your teeth will look brighter and whiter. And shinier. They'll feel smoother. You should notice your breath feels fresher and better. You just feel more hydrated. And the thing is, inflammation in the mouth doesn't just stay in the mouth, it affects the whole body. So it's very likely, depending how imbalanced you are, you may notice systemic benefit as well. Your gut health can improve. Think about if you have pathogenic bacteria in your mouth, you swallow up to 2,000 times a day, that is impacting your gut health. And so you may notice your digestion's better, less bloating. Um, you know, who knows? H. pylori can be impacted, candida, all of these things. So it can have a lot of downstream impacts.
And I imagine like your social life will get better as well because it's like one of the things that obviously people are really insecure about as well as turns people off is when you have bad breath. And so if you're consistent about taking care of your oral health, making some of these lifestyle changes we've talked about, I imagine you'll have a better social life as well. Be more confident.
Yeah, and just people who take care, it's personal hygiene, right? I mean, people who take care of themselves, I mean, that's to be respected, but also you will just feel better. And there's it's longevity too. It's optimization. So your mouth can't be ignored. It's part of your body. It's the gateway to your body, honestly.
Yeah. And so what's typically going on like before I let you go, like when people like spit their toothpaste out in the morning, there's a little bit of blood. I mean, is that like gingivitis or decay?
Not decay, but probably it's a sign of gum disease, most likely. Yeah, you want to get it checked out. I mean, sometimes it's isolated. Maybe you have a filling or a crown that the margin just isn't ideal. And so there's always that one spot in your mouth that kind of bleeds. I'm not saying ignore that, but that can be hard to fix without fixing the filling. But if it's kind of generalized, it's a concern. It's a concern. And for me, what motivates me is brain health. I do not want dementia or Alzheimer's. P. gingivalis is the bacteria that is found in the mouth. It's part of gum and periodontal disease, and it is found in the brains of patients with Alzheimer's. So the thing is, bacteria in the mouth don't just stay in the mouth. They can translocate. They can, if your gums bleed, now the bacteria can get into your system, travel around the body, end up in organ systems they shouldn't, but they also release toxins that can create inflammation and have like a cytokine storm type of situation. And it's not great long term. So gum health is incredibly important. I cannot overemphasize it.
Dr. Whitman, thank you so much for coming on the podcast. I really, really enjoyed this conversation and I learned a lot. Thank you.
Thanks, Doug. Hope it helps people.